Travis had a way with words. A gentle, timid soul, he was not particularly adept with people, but was expressive and insightful in his many writings. He was bright, so much so that despite his young age of 22, he often became impatient with the ineptitude of his fellow humans and the inconsistencies of an irrational world. Why he developed a mysterious disease that consumed him and made him lose his way is beyond comprehension. Bugs, worms, or things he couldn't describe seemed to be infesting his body and his brain, tormenting him with itching, biting, and stinging sensations. Strange things were occurring that made no sense to his rational mind. Fuzzballs, filaments of different colors, and black pepper like dots were emanating from his pores and making his skin feel like it wasn't his own. He couldn't sleep, he couldn't concentrate, he couldn't work or enjoy life in any way. He went from doctor to doctor in desperation, seeking to discover the cause of his misery, hoping to find a diagnosis to explain his bizarre symptoms. He hoped that even if none could diagnose his malady, someone might at least listen, look, and try to understand and help him. Excerpt from Travis's story in Ginger Savely's Morgellons, The Legitimization of a Disease.
Every culture has its ghosts, its legends, its mysteries.
From UFOs to haunted houses, psychic visions to cryptids, we explore the stories that defy explanation and what they reveal about what it means to be human.
I'm Chris Daly.
And I'm Ryan Geckner. We're anthropologists asking big questions about belief, experience, and the unknown.
This is Beyond the Human. Hello and welcome to Beyond the Human, or welcome back, hopefully, to Beyond the Human. Today we're going to be talking about, I'm going to say Morgellons or Morgellons. I've heard both pronunciations and I don't know which is legitimately correct, but we will be talking about this contested illness or medical mystery. So if you've never heard of what a medical mystery is or what a contested illness is, it's not simply something we don't know the cause of. It goes beyond that. It's something we really, really don't understand. And in the case of many things like Morgellons, it's something that the medical community doesn't necessarily consider to be real. Or they throw it into a psychiatric category when there's other pieces of it that don't really fit psychiatric illness, that are really more of a physical illness. And so when we look at these kinds of things in anthropology, we try to understand them from the perspective of the people going through them, rather than simply what the medical community says. And often you find that there really are definitions available. There really are causes available, many times, not always. But there really are diagnostic criteria that should be applied and just aren't, in Western medicine. So in anthropology, we sometimes call these things culture-bound syndromes. Not always, but just to explain a little bit about what a culture-bound syndrome is, this is something that is found only in one particular culture or might be shared among a couple of cultures, but it's not found around the world. So it's something that people define within a culture. And many times other cultures will define them psychiatric. And so, many times that's how things fit in. Morgellons, I don't know if it's a culture-bound syndrome. I think the jury is still out on that one because we don't know if this is found all over the world. We know it's found in many different societies, in Western societies throughout Europe, throughout the Americas, and that includes, not just North America. It goes south of the border as well. But we're not really sure if it's found elsewhere. No one's done the research. So I don't know that I would necessarily term this one that way, but it is definitely a contested illness. It is definitely a mystery. We don't know that much about it, but we're learning. And so I'm going to turn it over to Ryan and let him tell you a little bit about how we're learning about this.
Yeah. So well, I think the thing is, we actually know more about Morgellons or Morgellons than we.
We're going to keep doing.
Yeah, we're going to keep doing that. I promise. After this, I'm just going to stick with one pronunciation. I think we know more about it than we give credit. And I think, one of the things that, we're interested in, and you are, was kind of where this interest really started, was with, your interest in medical mysteries from a medical anthropology perspective. And so, about a year or so ago, a little over a year ago.
Maybe a year and a half at this point, even.
Yeah, it might be. Yeah, I think you're right. We started working on a project to understand sort of the lived experiences of folks who have Morgellons. And so we worked through, one of the foundations that we'll talk about here in the episode, worked with them to kind of identify people who have Morgellons and also kind of branched out into social media groups, Facebook groups and things like that to identify folks with the disease, to learn just about, not whether or not we think it's an actual disease or to understand what causes it or doesn't cause it, but more importantly, to understand, that people are having some sort of experience, and they are placing it under this umbrella of Morgellons, and we wanted to understand what it's like to live with that diagnosis or with that understanding. And we talked also not just to patients, but we were interested in kind of how it impacts people in their lives beyond themselves. So family members, also, their physicians, and other professionals that they were working with, to sort of to get a better picture of sort of what Morgellons looks like, for people, because we don't, as we talk through the rest of this episode, we'll kind of discuss sort of how Morgellons is a contested illness and how, you know, oftentimes people with Morgellons are, to put it very frankly, are gaslit by the medical establishment. And so we wanted to get a clear understanding of that and try and, you know, consolidate that in such a way that academics and researchers have something a little more, not necessarily concrete, but something a little more, I guess, structured to look at and understand what these people are going through. And so we just finished, at the time of recording, we just finished recruiting for that, and we had, I forget how
We've
many
had right
people,
around 80 interviews
80 interviews.
and long interviews. I mean,
Yeah, really
some
long
of these
interviews.
were a couple of hours each and
Mhm.
really humbling interviews,
Yeah.
listening to the suffering that's going on. I mean, you really start to understand how people get through day to day, just
Mhm.
horrific
Mhm.
things with this disease that the medical establishment won't even
Yeah.
recognize. And spoiler alert, I do believe it's a disease. I don't believe it's simply a psychiatric, and I don't, this simply is the wrong word. Psychiatric illnesses are not simple.
Yeah. Yeah.
But I don't think this one is a psychiatric illness. There are too many things going on that make me believe otherwise.
Yeah.
Um, but these were incredible interviews, and we hope in the future, once we've gone through all of them and analyzed things a little bit more, we're definitely going to write a book.
Yes.
And
Yes.
I do think we'll have another episode kind of talking more about what people said. We'll reference some of it now, but we haven't had a chance to go through it all
Mhm.
yet.
Mhm. Mhm.
Now that we've kind of said all of these things, what is Morgellons disease? Well, the distinguishing characteristic in my mind and in the mind of Dr. Ginger Savely, who is I think one of the leading experts on it. She's
Mhm. Mhm.
certainly a clinician who has worked with a lot of patients,
Yep.
and I highly recommend her book
Mhm.
if you're interested. Uh,
It will be in the show notes.
she will name, and I would agree with her that the diagnostic criterion that we should be looking at specifically is the presence of microscopic subcutaneous filaments. And these things they've been analyzed. They're made of keratin, they're made of collagen. These are natural substances the human body produces. So, you know, some people will tell you that they're fibers coming from clothing and things like that, but they've been analyzed. So
Mhm.
it's the presence of these subcutaneous filaments that come out of the skin. They come out of open sores on the skin, and at some points they are big enough that you can see them with the naked eye. At other points they are not. So some people actually never have these things that you can see with the naked eye, but they are present if you look with a microscope, and it has to be, a 60x microscope. So you really have to look for these things. So that seems to be the one diagnostic criterion that we can really say is Morgellons. The really interesting piece of these filaments is that they are all different colors.
Mhm.
So red, blue, some are white, some are clear, some are black. Um, but they're colorful. I mean, you see pictures of them and hey, it's red,
It's
white, and blue. And
striking. It is. It is.
it's
Remember,
July, so
it's striking that they look synthetic.
Yeah, they do.
I
They
think
do.
that's the, and I think for a lot of people that is probably where some of their skepticism starts with Morgellons is like, this is as this kind of the baseline for understanding what Morgellons is. And if you look at pictures of Morgellons fibers, I mean, it just looks like, fabric, like fabric
Right.
fibers, and bright colors. They're not colors you associate with like naturally occurring human bodies, if that makes
Right.
sense.
Bright red,
Yeah,
bright blue is
it's
not what you
no,
would
no.
think of. When you think of, keratin and things, you think of your nails, you think of your
Yeah,
hair,
yeah.
so that's not what you're thinking about. And the other piece of that is, when you have an open sore and you have clothing over it, you can get fibers
Yeah.
from your clothes in there. And so in some cases, when you look at something, a sample from a person, it actually is from clothing.
Hmm.
But we want to make it very clear that when we talk about Morgellons fibers or filaments, we're not talking about the clothing pieces that are in there.
Hmm.
We're not talking about what I would call contamination of a
Yeah,
sample.
yeah.
So we're talking about these things that are actually coming from the skin. And some people will argue that those aren't real, they don't exist. But we have many of clinicians who are
Hmm.
telling us, no, I've looked, I've
Hmm.
seen them coming out of a person's skin. I know for a fact from a clinical perspective
Hmm.
that these are filaments that the body is producing. And so that is the true diagnostic for Morgellons or Morgellons. So that's that main diagnostic, but there's a lot of other symptoms
Hmm.
that are involved in this illness disease. Um, One of the most common ones is itch.
Hmm.
And so the sores that people get, or even just sometimes their skin, likely because of these filaments coming out, they get very itchy.
Hmm.
And so that it's, this itch that kind of won't go away. And I think that's where some people start to move into the psychiatric diagnoses.
Hmm.
And we'll
Yeah.
get to that. I don't even want to mention
Hmm. Hmm.
those yet, but itch is one of them.
Yeah.
And the sores, I mentioned that sometimes these fibers are coming out of sores, and these are large sores. Sometimes they can be all over the body. In some cases, some people will talk about them being only part of the body. Some of our participants talked about, in particular, on their face, which, as you
Hmm.
can imagine, is really not a fun thing to have
Hmm.
happen.
Hmm.
Um, I don't know if you remember what other people talked about different patterning of
The
those.
face was the big one that stands out to me. And I think the other thing, not to go back to the itching, is, when people talk about this, like I get really not like horrible reactions, like anaphylactic or anything crazy like that, but like when I get like mosquito bites, like they itch like I have a reaction to those, and that is an itch that like is a lot. But when talking to Morgellons patients, they talk about the itching as like you cannot satisfy it, and it is not something you can just ignore, right? Like if I get a mosquito bite and I like just ignore it and go about my day and I'm doing stuff, I don't realize or I don't think about it, right? But like talking to these folks, it's something you can't, it makes it difficult to function. um and yeah, I think the sores, the only other patterning thing that I can think of apart from the face is like some people talk about, depending on where they think Morgellons came from for them, and we'll talk about some of these possible sources. Whether it was a tick bite or not, some people talk about, patterning around the bite site, um, as well as one of those places. But the thing too is like some people don't even get those lesions, they just have the fibers. And so it's not necessarily a situation where you're only seeing the fibers coming from the sores. You can have the fibers come from any old place in your body. I mean, I remember having people talk about like seeing them in their eyes, like, feeling like they have something in their eye, and then they look in the mirror and they see that there's like something that looks like one of these fibers in there. Um,
And I mean, I had some people talk about how like, I had one person who said they were actually diagnosed by their dentist
oh yeah,
because
yeah.
there were these filaments coming out from in between their teeth on their gums.
Hmm.
That's not normal.
Hmm. Hmm.
I had another person who said that her gynecologist
No kidding.
found fibers
Wow.
coming out during a pelvic exam. And
Wow.
I had two people who said that their gastroenterologist found them on colonoscopy. So these are internal,
Right.
and in one case, the gastroenterologist was like, I've never seen anything like this. This is crazy. And,
Yeah.
so these are not filaments that are, only in places where clothing would be. That's a
Mhm.
very important piece
And
to
that's
know.
really interesting, just that fact alone, because though those are from talking to patients, most of the people are going to the regular PCP first and being dismissed. And it's interesting hearing that patients were going to specialists for completely unrelated things, and the specialists are like, "Hey, I don't know what this is. This is weird," and not jumping to some quick diagnosis that doesn't really take into account everything that's going on. So that's interesting.
Yeah, they're just sort of saying, like, this is odd. I'm not supposed to see this.
Okay, this
They
isn't
do.
supposed to be here, but it's here.
So those are kind of the most common things people talk about.
Hmm.
Then you move into some of the other pieces of the diagnosis. So brain fog
Hmm.
and intense fatigue.
Yeah.
Also some joint stiffness. Some people talk about just having other neurological kinds of things going on, cognitive impairments, not just simple brain fog, but kind of really debilitating
Hmm.
cognitive impairments. People talk about vision and hearing changes. So again, all of those neurological kinds of things, and then the fatigue mixed with sort of joint stiffness. Um, and all of these are symptoms that are associated with a lot of different things, and that's why it's difficult. It's difficult sometimes to say whether something is Morgellons or is something else that the person
Hmm.
also has.
Yep.
So I'm just sort of presenting what the majority of patients are telling me
Hmm.
that they're experiencing, and it doesn't mean that some of these aren't due to something else.
Yeah.
And that's always really a complicating picture for whenever you're trying to figure out a new illness, a new disease is, what is actually part of that disease versus what's external to it. Um, so other things that have been mentioned, changes in your gastrointestinal system. So, diarrhea, constipation, that
Hmm.
sort of thing. Um, just generally not feeling well.
Hmm.
In some cases, people talk about extreme pain, particularly in the joints, but overall, just having pain, kind of like a fibromyalgia sort of thing,
Hmm.
which is another thing we might want to do.
Yeah, that would
So
be, yeah, yeah.
now that's become a little bit more
More
accepted.
accepted, yeah,
Yeah.
which the process of that becoming accepted might be interesting
Yeah.
to look at.
Um, yeah, dental deterioration. People talk about having their teeth kind of
Yeah,
rotting,
teeth problems, yeah.
which is not great. Sleep disturbances is another one, and I mean that one may be secondary to all of these other things.
Yeah, a lot of people that I talk to would talk about like the itching being particularly bad at night. Would talk about there was a couple of people I talked to with that there was several people that mentioned scalp issues, like
That's true.
itchiness
Yeah.
specifically related to the scalp, and a lot of times they would talk about that being a particular problem in the evening when they're laying down to bed, and feeling like
And to the point where they
itchiness
shave
or
their head.
pain. Yeah, and some people, yeah, get to the point where they just shave their heads. Um, and so that, yeah, but yeah, I agree. I think the sleep one is like, well, if you're super itchy all the time, it's gonna be hard to sleep. Like that's just it's gonna be,
If you're in pain.
or you're in pain, right? Yeah, whether it's Morgellons or not, that's it's gonna be hard to sleep.
And then, I mean, to talk a little bit about the psychiatric things that
Hmm.
happen, and I will say over and over, I do not believe this is a psychiatric illness.
Hmm.
I do, however, believe that there are psychological things that happen
Yeah,
when you're
yeah.
going through this experience. I mean, if you listen to the disease and the symptoms we're describing, would you imagine that someone might get depressed?
I was gonna say, yeah. I mean, like all of these things really quickly impact your day-to-day
Right.
quality of life.
And so the typical sort of anxiety, depression, panic attacks,
Hmm.
those kinds of things very much happen.
Yeah,
And I understand completely why they would.
yeah.
That doesn't mean that they're causing more gallons,
No, right.
you
Yes,
know. And
yes.
so that's important. But people can be diagnosed with all kinds of psychological things happening,
Hmm.
you know,
Hmm.
during Morgellons. And
Yeah.
I would argue that the Morgellons is causing some of them.
Hmm.
So that I think kind of paints a pretty good picture of what the symptoms are
Yeah.
and what the presentation is. Um,
So I want to just suggest to our listeners, consider what it would be like to have that list of symptoms, right?
yeah.
And maybe not even all of them, but like, you've got these weird filaments coming out of your body that you can't explain. It's itchy, like you can't believe. Um,
And to go back to the filaments, I think it's important also to talk about the fact that these filaments wind up all over.
yes.
I mean,
Yeah.
people talk about finding them just all over their house.
Cars. Yeah.
Yeah, I
Yeah.
mean, and in their bathtub,
Hmm.
and we'll talk more about some of the other things that people are experiencing. It really, um, it's horrific what
Hmm.
people go through
Hmm.
with some of these things. People talk about how, they're taking baths every night to try to help, soothe themselves, and they're finding like a film all over the bathtub
Yeah.
made up of these fibers and
Hmm.
this gelatinous material that also seems to come out with the fibers.
Hmm.
And we didn't mention that there's
Yeah.
this like gelatinous material that comes out and glitter
Yeah.
sometimes.
I was just
It's
gonna
a
say the
kind of
glitter. Yeah.
substance.
People talk about it. I mean, it's like, I've seen pictures people have shown us, and it looks like glitter, honestly, like
Yeah, it
really
really
tiny
does.
glitter, that is not glitter. I have no reason to doubt the people we've talked to that, they're like, well, yeah, I don't put glitter on every day, like
I mean, if you do, go
if
you.
you do live your life, but you probably don't have Morgellons, or the glitter is not the cause, it's not,
Right.
associated with the Morgellons, but I it's bizarre, right? I think just to consider all of those symptoms and have it be really unclear about where that came from, right? And then, we'll talk a little bit about, kind of how the medical establishment deals with that. But I want people to kind of keep that in the back of your mind because I think it's really hard. I know for me, before we started doing these interviews, I would get off of interviews and I would go tell you or my wife, like, hey, I feel like I just lived through an episode of the X-Files because just listening to people's experiences, was really just mind-boggling, a little bit, just because it's hard to imagine what that would be like. Because people end up, losing family members over this, or have family members who are like estranged and won't talk to them about it because they don't believe that it's real. And I think that's really it was very humbling for me, to hear those experiences, because I was familiar, or at least, sort of familiar with Morgellons before we did the project, but I'd never really talked to people who had it.
Yeah, and it is really, I mean, they are totally ignored by not just the medical establishment. And I do think we should kind of go through what that looks like,
Mm.
kind of getting that diagnosis.
Yeah,
But, friends and family totally not believing them.
yeah.
That again adds to the psychological
Hmm.
impact
Yeah,
of
yeah,
having something like
yeah.
this, let alone the fact that you have, fibers coming out of your body,
Hmm. Hmm.
which in and of itself is horrific. I can't
Yeah, it's
imagine,
alarming. Yeah.
I can't imagine going for, a pelvic exam or a colonoscopy and having the
Hmm.
doctor be like, oh, wait, hang
I
on,
found this
what's
weird
that?
stuff. Yeah, right.
You know,
Yeah.
so, very, very humbling interviews. Right. So.
So where did Morgellons come from? Or where do we get our first examples of Morgellons? Well, it's kind of tricky to say. We have like kind of one sort of date, in the 20th century that we can point to, but there's a couple of examples that are earlier that some folks, say could be Morgellons, but it's kind of hard to say. So, we'll start with the oldest example, from
1544.
1544. So we're talking way back, but obviously well before the development of modern medicine, right? And so this condition becomes known as Pilaris affectio, which just means hair affection. What language is that in, Chris? Is that Italian?
That
Latin?
might be Latin.
Latin, Italian,
Latin.
they're related, so close enough. Um,
Close enough.
but this becomes associated with pain, itching. So far, okay, we're like checking some boxes with Morgellons, and also convulsions and wasting away, which doesn't totally jive. But, people are observing these hairs coming out of skin that some people are referring to as little worms with black heads. So we're kind of checking some of these boxes. And in the 17th century, there's a British physician who's analyzing this stuff and looking at all of this. And he refers to the condition as Morgellons. And this is the first time that we get something called Morgellons. Now, whether or not this is Morgellons as we understand it today is up for debate. But that's kind of where the name comes from. And Chris, did you want to read that?
Well, this is okay. So this is something that was not referred to as Morgellons yet, but this is from 1674.
Yeah.
And this is a British physician by the name of Thomas Brown, and he's describing something that he's seeing. And it remember the
It's
year.
written in
It's a little,
1674.
it's written in 1674, so it's a little difficult. So I'll go
So
kind of
put your
slow.
powdered wig on and
Yeah. So hairs which have most amused me have not been in the face or head, but on the back, and not in men, but children, as I long ago observed in that endemial distemper of little children in Languedoc called the Morgellons. Oh, it is where they talk about Morgellons.
yeah,
Okay.
yeah. Mhm.
Wherein they critically break out with harsh hairs on their backs, which takes off the unquiet symptoms of the disease and delivers them from coughs and convulsions. So I don't talk like that. But deciphering it a little bit, they're seeing something that looks like hairs coming out of parts of the body
Mhm.
that they shouldn't come out from, and they're calling it the Morgellons. And I thought, okay, I didn't realize that was the first use of that term. So that was 1674. In 1682, Dr. Michelle Etmiller created some drawings of microscopic objects believed to be a worm infection in children. And they look somewhat like, we might be able to put that picture up in the
Yeah, we
notes
can.
too.
Yeah, we can put that in the show.
Um, but they look somewhat like what Morgellons patients are describing some of the filaments to look like. Not entirely. They also kind of look like bugs. So, but to be fair, patients do describe some of the things coming out of their body as really looking like insects.
Insects, yeah.
And seeing some pictures, they do. Some of them do look that way. So this is going back pretty far that we're seeing things like this described. We don't know if this was actually Morgellons as we know Morgellons to be today, but that's where you start to see the terms. So if you fast forward to
almost 300 years.
Yeah,
like
way
a lot.
to June 22nd of 1946, BMJ, or the British Medical Journal, which is, if you're not familiar with it, it is a highly, highly regarded medical journal. It's an excellent journal. If you're one of those people who gets published in it, go you.
Good for you. Please keep listening. We're happy to have you here.
Exactly. It's a great journal. And so there's a publication, and this is just a letter to the editor, but it's from a microbiologist by the name of A.H. Emsley Smith. And it says basically, the condition described as Morgellons might be gadfly infestation. And if you're familiar with gadflies, they lay their eggs under your skin and it sort of emerges. It looks sort of kind of like Alien, the movie.
Okay. All right.
So for a time, there was this idea that maybe we're talking about gadflies. And what's interesting to me about this letter to the editor is no one was really talking about this disease in the medical literature at that time. So this letter to the editor kind of comes out of nowhere, saying like, oh, this stuff that we were talking about, 300 years ago. So clearly something was going on. Clearly people were seeing these symptoms again, and it wasn't making it into the medical liture of the day, which is, that's not completely shocking. It's, not everything is in the medical literature, but somehow this letter gets published. We know today that gadfly infestation looks totally different, and that is not what we're talking about, but that is another reference to Morgellons, at least in the 1940s. Because then we need to fast forward even further to 2001. Though I will say,
in this century, folks, we made it.
but I will say that Savely does talk in her book about having patients with symptoms back to the 1950s.
Yeah.
So we do think that this dates back a little further.
And that timing is particularly interesting.
It really
we will talk about that later, but I want you to keep in mind late 40s, early 50s. Think about what was going on in the world, and we'll come back to that.
Yeah. So in 2001, we have Mary Lytow. I don't know if I'm pronouncing that correctly, but she's a microbiologist in Connecticut, I believe.
Also in
And
Connecticut, that's wild. Anyway, keep going.
hey,
That's going to be important later, everybody.
in 2001, I lived in Connecticut. So
No, that's true. You
I
did.
did.
That's true.
Um,
Explains a lot.
so we have this microbiologist, and she notices a sore on her son's lip, I believe it was, that was not healing. And this was concerning to her. And so she's looking for, a reason. She brought him to the doctor, this and that. And so they can't figure out what it is. She creates this description of what's going on with her son. And this is the first modern description of Morgellons.
Mhm.
And she uses that name. She brings the name back. Come from kind of finding those drawings from Etmiller in 1682 and brings this name back from that time period. So she brings the name Morgellons in and creates the Morgellons Research Foundation. And with that foundation, she starts the first online database where patients could report their symptoms. This is really important. The fact that for the first time, you have people able to report their symptoms somewhere
Right.
onto this online database. It's also equally important to recognize that her Morgellons Research Foundation and her website was closed in 2012. The website, the domain name was purchased by somebody else, and there is now a different Morgellons Research Foundation. And it is it's completely separate, has nothing to do with her, and they promote a theory that Morgellons is coming from chemtrails, and we'll talk about that later.
It gets very conspiracy.
Very conspiracy. But I see why, and
yeah, it totally makes sense. I mean, given the way that people are dealt with, yeah, it totally makes sense.
yeah. So she started that foundation. Flash forward a little, and I don't remember what year the Charles Holman Foundation was started, but we worked with them for the study that we were doing, and they do the majority of the research now, and we'll put their link in our show notes as well.
Yeah. I was looking for a date for them,
Oh,
and I couldn't find it.
Yeah, I'm not sure, but we'll talk also, about kind of what they're doing later.
Yep. Yep. So, okay, that's the history. We know a little bit about what it looks like. So, what causes Morgellons? And I think that is the million-dollar question. If you could answer that question, this would no longer be a paranormal podcast. This would be a medical podcast. And so there are lots of explanations that patients ascribe to their symptoms and the disease itself. But I want to start us off with what the medical establishment sort of uses as their explanation, which is unfortunate. So
when we say medical establishment, we mean the CDC.
Yeah, we mean the CDC and anybody who's following CDC guidelines. So imagine you go remind yourself of like 10 minutes ago or however many minutes ago it was when I said, think about what it's like to have Morgellons. Imagine you're someone with Morgellons. Imagine you have these sores, you have these fibers, and you're like, what in the world is happening to me? Well, what are you going to do? You're probably going to go to your, regular doctor or urgent care or something along those lines, wherever you get your medical care from. And you go into the office and you explain all of these things, and
you bring samples.
You bring samples, which is something that a lot of patients do.
It's something I would think to do.
I would think I would do it too, right? Because like if fibers are coming out of my body, I'm going to assume no one's going to believe that, because that does just sound a little wild, right? Like it sounds very bizarre. And you tell your physician this, and their response is, well, you're delusional. You have delusions of parasitosis. So that means basically you have a delusion that you have some sort of parasite in your body. So I think, based on all of the people I talked to in this study and just my own like thinking about it, that is not a very satisfactory diagnosis for a couple of reasons, right? So
most people give that diagnosis without examining the patient.
Yes, right. Like exactly how I explained it, right? Like you go in, you tell your doctor all this stuff, you got this little Ziploc bag with some fibers in it, and they're like, oh, you're just crazy. And that's like it. Like I didn't skip a step. There's no testing. There's no like stuff gets sent off to a lab and you go home and get a call later and your my chart or whatever, like it's nothing like that. Like literally you just walk in, you say, I've got these fibers, and the doctor's like, well, you're delusional. And that just seems bananas to me. But it's all because of a CDC study that started back in 2008. And Chris, you remember this better than me, so I'm going to let you explain that, and then I'm going to talk about why this is totally a ridiculous diagnosis to begin with.
Yeah, so the CDC, people had been petitioning the CDC to figure this out. And so the CDC said, okay, we're gonna do this study. And so they did a study in Northern California, which, okay, let's just start there. That's a little weird given that a lot of these cases were on the East Coast. But so fine, they had the ability to do this in Northern California with patients from Kaiser Permanente. And that's fine. I'm not saying anything against Kaiser,
It's a convenience sample.
but it's
Well,
but
not a good way.
if you're going to do a large scale study, typically you would work with multiple health systems. But okay, you can start small. That's okay. So they start.
You are the CDC and you do have money, but fine. Cool.
Well, they didn't dedicate a ton of money to this. That I know. So they do a study with Kaiser Permanente patients, and I want to talk a little bit about their sample. Remember, I'm a methods person, so
No, that's
sampling.
important, folks. This is
important.
This is why methods are important, folks.
So they found people in this sample. These are folks who had not been clinically diagnosed with this. These are people who said something about, I feel like there's things crawling under my skin. I think there's fibers coming out of me. They're not people who any physician looked and said, well, I see this.
Right.
They're not even people who necessarily looked themselves under a microscope
and thought they had Morgellons
and saw this. So you're biasing your sample automatically by not going with people who have been told like you have Morgellons. And I know it's not a diagnosis that's in, there's no ICD code for it. But Ginger Savely was working with folks at the time, and she offered up her patient population to the CDC and said, here are people who I clinically am saying have this disorder. So I don't understand why you would not at least look at some of those folks.
Right. Like, oh, here's some more people I can add to my sample.
Right. I mean, fine, use the folks from Kaiser Permanente as well if you would like, though I struggle with that.
Comparison and
It's a great
much
comparison.
better paper, just saying.
But I really feel like, if you have people who have been diagnosed by a clinician who has seen this and believes them and says, here's my criteria, here's how I determined that the person had this, that's the sample I would use. They didn't, so fine. They have a sample that I would say is questionable. I don't remember the number of people in the study, but it was not super high.
Yeah, I don't think it was a lot. No.
But,
we will link the study in the show notes.
Yeah.
And because it's CDC, it's available to everyone in the United States.
It is available.
You're welcome. Your tax dollars at work.
That's all my tax dollars are doing. We have a problem.
Well, you know what? I'm not gonna say anything. I'm gonna keep that to myself.
We have a CDC study.
We do.
And they came back with this is not real, essentially, that this is psychiatric. And I know I keep saying not real.
They didn't even meet with patients though, right?
Yeah,
like it was just like
they just looked
medical
at records.
Yeah. And it's like, if you took a selection of patients that had like, I don't know, stuff that's, symptoms that are associated with some cancer diagnosis. And then you were like, well, I'm going to see if they actually have cancer, but I'm only going to look at their medical records. And then I'm going to say, well, the cancer isn't real. They don't have it. It's like, that doesn't, you don't have to.
I want samples.
Yeah.
I want
right?
tissue
like,
samples.
You don't have to be some like hardcore NIH, CDC level scientist to know that doesn't make sense. Like it just doesn't track. Right. And it just bothers me. Yeah. And so even beyond the CDC study, let's talk about this whole diagnosis of delusions of parasitosis for a second. Because the bone to pick that I have with this, and this is after kind of talking with patients and hearing their experiences and having it be like, yeah, I just walked in, I told them what I have, and they said I'm crazy. And it happened as simply as that is, that delusions of parasitosis is not a formal DSM-5 diagnosis or a diagnostic and statistic manual of mental disorders diagnosis. That's what psychiatrists use to diagnose, or psychologists and psychiatrists use to diagnose mental conditions. But it's close to just a generic delusional disorder. And there are specific criteria if you ever go Google the DSM because you're like a nerd or something.
Well, we did it.
We did, yeah. I'm not saying I'm not a nerd. Like you're in good company because you're hanging out with us. Everything that's in the DSM has a list of criteria that are used to determine a specific diagnosis, right? Because with mental disorders, it's not as simple as like, okay, I can run this test and send it off to the lab and diagnose you with the thing. So no, it's not. Mental disorders are difficult to diagnose, and there's a big long list of these. It's not actually that long, but the last criteria is and this is a direct quote from the DSM, is that the disturbance is not attributable to the physiological effects of a substance. So, say like you think you have, bugs crawling under you because you're methed out, then okay, well, we can attribute that to your methamphetamine use. Or another medical condition and is not better explained by another mental disorder. And so to check the boxes of a delusional disorder, a physician is supposed to make sure
That you don't have something else.
that you don't have something else, and no one's doing that. And that is just, I mean, I like to be annoyed with the medical system most days of the week, but like that is just like that's the whole reason you go to the doctor is like I'm not trained to know what this is, so I'm going to you because you're the expert. And then the experts aren't even doing their due diligence.
I was saying the experts are not even examining.
They're not even
not
trying. Like it's just
they're
like,
just saying you're crazy.
And you might be, but like you should at least check and make sure. Like,
right?
Come on. Like what?
We're not saying there's nobody with Morgellons who isn't also crazy.
Yeah, because you can be both. This is true.
But what we're saying is that one does not equal the other.
Yeah, and that just really bothers me. And I had one of the folks I interviewed brought that specifically up. They were like, "Oh, look at this in the DSM," and they're supposed to say that it's not something else, and they're not doing it.
And that's something I'm glad you said that about someone you interviewed, because we interviewed about 70 people, and these are incredible.
About 70 patients. Yeah, we had like family members and other stuff.
Right. These are incredibly sane people.
Yeah,
Many of them highly educated. So many nurses.
Dude, a lot of nurses. Yeah,
which lends credence to the idea of infection, but we'll get to that.
Right.
But these are not people who are just like, hey, I just think, I'm
a little itchy today.
It's not that. Yeah. And you talk to people and you can feel through Zoom, because we did a lot of these on Zoom because they were around the country. You can feel through Zoom.
Around the world. We had people,
we had people from Europe too, yeah, and Canada, and you can feel the frustration.
Yeah.
And the anger at the medical professionals. And let me just use the example of some of the nurses who are saying, I went to people who I worked with for 20 years, and they're telling me you're crazy.
You're just crazy.
And that's, imagine.
It's dismissive.
What that would feel like. And so I understand the frustration.
Yeah.
And I see the anger.
Yeah. And so that's basically the going explanation. If you go down to your friendly neighborhood primary care physician, that's probably what they're going to tell you.
You're going to say your friendly neighborhood CDC website.
Well, or that too, whatever, tax-funded CDC website, or if you're in Atlanta and you go and knock on the CDC's door, that's what they're going to tell you Morgellons is.
Right.
There's no other explanation for it as far as they're concerned. Now, if you talk to Morgellons patients or physicians who take the disease seriously, like Ginger Savely and other folks that we talk to, they have a lot of other possible explanations. And there's kind of some different camps. Basically, the whole Morgellons community is kind of cut up into these little camps of what you believe it is. And so the first, I guess the best place to start is with whether or not it's an infectious agent, right? And that is so not my wheelhouse. So I'm going to pass the mic.
But aren't we all experts in infectious disease post-COVID?
I think we could hope that people are, but I don't think
we're more knowledgeable than we used to be.
Okay, we'll go with that. Yes. I did see someone with a mask on at Walmart the other day, so maybe we learned some things. I don't know.
Did it give you a PTSD flashback?
No, no. It was an N95, and I was like, "Wow, you're not wearing that appropriately. Why wear an N95 if you're not going to wear it appropriately?"
Nice.
But I was like, maybe she got a cough today, and she's trying to keep everybody okay at the Walmart.
Well,
So
that's a good thing.
I choose to believe the good.
I'm a fan of masks if they're appropriate.
Yeah. If you're sick, wear a mask. There's nothing's not going to hurt anybody.
Yeah. All right, so let's talk about it, the possibility of this
Mhm.
being an infectious disease, because actually the one of the leading theories, I won't say the leading theory, but one of the leading theories that
I'd
that
say
a
it's probably
lot,
the most popular.
yeah,
Yeah.
is that this is somehow related to Lyme disease. And there is some evidence for this. If you look in the literature, there's a group of scientists who have been working on this
Mhm.
and have found some interesting things. And that is that a lot of Morgellons patients, I think it was 95% in one of the articles, are testing positive for Lyme disease.
Mhm.
Not 100%, 95%. And there's
So that's still pretty good given Lyme tests.
yeah. So yeah, let's talk about
I
Lyme
was going to say
testing,
we should talk about
which
that. Yeah.
is terrible.
It's not good.
You
It's so
know,
bad.
when we look at testing for different diseases, we think about, you know, uh, sensitivity, specificity. We think about, are you getting false negatives? Are you getting false positives? Can you diagnose this disease? And the problem with Lyme disease, there's multiple tests that they do, and they still don't catch everybody.
Mhm.
The testing for Lyme disease is not good. Um, and so, it's possible that 100% of Morgellons patients have been exposed to Lyme. It's possible that, this is a presentation of Lyme disease. But because Lyme disease testing is poor, we can't say that for certain. But I will say, that's an awfully large percentage of people to test positive for Lyme.
Mhm.
Um, so is it possible that these things are related? I think it's very possible that they are. So Lyme disease, uh, if you're familiar with it at all, there's a tick bite, right? And you get infected with this spirochete. It's a type of bacteria called a spirochete. They're little spirally things, hence
Mhm.
the name.
Yeah, they're fun.
So Borrelia
Not fun, but fun to
burgdorferi.
look at.
Yeah. So Lyme disease is this spirochete called Borrelia burgdorferi, and that is named after the guy who
Willy Bergdorfer.
Willy Burgdorfer, who is the one who identified the spirochete itself.
Boy, Willie.
So you get infected with this. Now, everybody knows that if you get Lyme disease, you have this bullseye rash. Except that's
When
only
you don't.
except when you don't. Yeah. It's only about 50% of the time that you actually get that bullseye rash. So just because you've never had the bullseye rash, don't think that you've never had Lyme disease.
If you have a tick, if you get a tick bite,
Yeah.
you should and you see the tick, you should remove the tick and then look up where you can send it. Because most states have a place you can send those ticks for free
That's true.
and get it tested for Lyme and a whole bunch of other things that ticks carry. And they'll even
Ticks carry a
a lot
lot.
of stuff. Ticks are gnarly, man. They're not good.
They're awful.
And climate change is going to make them even worse. So
They're everywhere, and
That's
they're
fine.
going to be even more places. I don't know what's more than everywhere, but
yeah, well, further north. We'll go further north.
yeah. So is it possible that this is a presentation of Lyme disease? I want to stick to that for a second because
Mhm.
think about what the symptoms of Lyme disease are. And I'm not talking about the short-term symptoms, which if you immediately know you have Lyme disease and you get antibiotics, you're good to go in a relatively short treatment
Mhm.
plan. There's also this thing called long Lyme disease, and it is another contested illness. And
Mhm.
I actually do think we should do a full episode on that. You can tell I really like contested illnesses.
They're fun.
I'm naming a lot that we should do episodes
Yeah.
on. So long Lyme is contested, and honestly, I don't understand how that is still contested either because there's so
Yeah.
much evidence for long Lyme disease. And there are these folks called Lyme literate physicians,
Mhm.
and
Which is nuts that has to be a thing, but
right.
that's just wild to me.
But
So-
they do exist, and some of them are the ones who are doing a really good job of trying to treat Morgellons patients. So think about some of those long Lyme symptoms. A ridiculous fatigue is a big one.
joint pain.
Joint pain is another big one. Brain fog is another big one. These are very overlapping
Yeah, the
symptoms.
Venn diagram of Lyme and Morgellons is
So I think
almost a circle.
I think there's a lot of evidence. I mean, okay, long Lyme patients don't talk about the filaments, which is why I said those are the diagnostic
Yeah.
for Morgellons. A lot of overlap there. So it's quite possible that, this is another presentation, or maybe it's, Lyme disease plus something else, because remember we said ticks carry a whole bunch of different things. So that lends to the idea,
Yeah,
that
and
there
and
there's something
and I
going on.
think the other thing too is, talking to some of the patients and some of the physicians, some the physicians who are in this camp of that it's some association with Lyme disease, give their patients the, standard antibiotic protocol that you would get for Lyme. And a lot of times that helps people. And sometimes I even had some participants who were talking about, going through periods of what they would call remission,
Hmm.
basically, where they would not have symptoms after going through this protocol for a while. And I know that some chronic Lyme patients talk about that in the same way,
Yeah.
where it's something they have all the time, but they'll go through periods of their life. I mean, I had one person, I think she talked about like having a period of remission that was like 5 or 10 years long
Yeah.
of Morgellons
And
before.
that makes so much sense with spirochete infections.
Mhm.
So if you look at other spirochetes, and spirochetes they're gnarly little
Nasty,
things.
nasty,
Let's
nasty.
talk about
Some
the
of the
other.
other nasty ones.
The big one is Treponema pallidum, which you may or may not have heard that spirochete's name, but I guarantee you've heard of the disease it calls and that it causes, and that is syphilis.
May have heard of that one.
You may have heard of that one. So if you look at syphilis, syphilis is staged.
Mhm.
In today's world, most people, not everybody, but most people are treated in stage one.
Yep.
When you first start having those symptoms, because typically in today's world, if you see something not so great going on in your nether regions,
Yeah, you go to your friendly neighborhood primary care physician.
and you get some antibiotics. So syphilis is highly treatable in those early stages. Then it goes through a second stage where you don't see any symptoms.
Yeah.
And so if that happens, sometimes people are just not diagnosed with it for a long time.
Mhm.
And, I mean, that happens so much that you may have heard, I don't know if they still do this in a lot of states, but getting a blood test before you get married.
Oh yeah,
The
yeah.
reason you got that
Yeah.
blood test, for those of you who got it, it was a syphilis test.
Yeah.
That's why they did that. It was to check to see if you had syphilis. So this
Not to
did
see if you're
happen.
related.
Yeah, it wasn't to check to see if you were related. It's about syphilis. But so then stage 3 syphilis is neurological. Syphilis does get into your brain, and that's what these spirochetes do. Lyme, we talk about the symptoms, and Morgellons fits that pattern as well, that things can get into your brain. Um, you know, so by all means, let's do another naturalistic experiment on another spirochete infection and see what happens if you don't treat it.
That's true. Yeah, what if we're living through like
That would be Tuskegee
another
for those of you that.
Tuskegee? Yeah, what if we're living through another Tuskegee? If you don't know what that is, Google it, friends. I'll put it in the show notes too. But
Yeah.
if you don't know what, oh man, I had never even thought about
Yeah,
that.
sorry, I
It
don't
just
like
occurred to me. Whoa, I don't like
Yeah.
that. That's not fun.
Yeah, we do like to study spirochetes in long term. So that's another spirochete. Leptospirosis, or the Leptospira species, a couple different species, they cause leptospirosis. This causes meningitis, liver failure, kidney damage, trouble breathing, can cause death. I mean, these are gnarly little
Fun
things.
stuff. It's fun stuff.
There are some other things that are related to the spirochetes. So, Helicobacter pylori behaves sort of similar to a spirochete. It's not a spirochete. So nobody jump on me. It's not a spirochete. I know that.
Everybody calm down.
Right. But it is a stomach infection. It can lead to ulcers, gastritis. It's got some ties to stomach cancer. Not a great organism. The Bartonella species and Bartonella species have also been found in Morgellons lesions. And they're, another nasty one. You may have heard of cat scratch disease. And those are actually small rods in terms of bacteria. They are also gram negative, and I don't think I mentioned that with spirochetes, but you have these gram negative infectious agents, which they're more difficult to treat. You can't use all antibiotics on gram negatives. They're a little more difficult to treat. There's only certain antibiotic classes that really work well with the gram negatives. If you're wondering what a gram negative bacteria is, they don't hold the blue dye that's used in the gram testing. They look pink or red when you do that. And the reason for that, they have a thinner peptidoglycan cell wall, and they have an outer cell membrane of lipopolysaccharides.
God bless you.
They're pink or red when you look at them after using the gram stain.
You lost me after pink or red.
So then another one of these gram negatives is the rickettsias. So Rocky Mountain spotted fever, also tick-borne.
Yep.
And this is rickettsia. It's like a spirochete. It's kind of similar, but it's rod-shaped. Um, Also has horrible symptoms, also has a rash, and it's also found in some Morgellons patients. So you have a variety of these infectious agents, which are not great to treat. They're difficult to treat. And that's kind of the, the take-home message here is that these are really difficult to treat. And in some cases, difficult to diagnose. Not in all cases. Um, so these are found in patients. Does that mean that these are the causes? I don't know.
Yeah, I
Um,
think the sense I got from like the couple of physicians I talked to, who were more of the, it's Lyme or something related, um, you know, their position, and I respect the position they had in the sense that they were like, well, I'm not sure what it is, but when I give people the Lyme protocol, they get better. So I'm gonna keep giving them the Lyme protocol, and I'm like, you know what? I ain't mad at you for that. Like that's
And the Lyme protocol is a bunch of antibiotics.
yeah.
And
So
so maybe there's bacteria in
maybe
there.
it's something going on. Like I don't know, but that I think, and I think that's what like is the most unsettling thing to me, talking to both patients and physicians who are like, taking it seriously, is just like how can you as a physician, you know, build your career on this idea that you're supposed to be taking care of people, and yet you're just going to write people off when, according to some other, professionals in your own field, there are ways you can treat this. Okay, maybe we don't know what it is, but like if it works, it works. So like,
Right. So why not try
why
it?
not? Yeah, why not give it a go?
Yeah.
And that just yeah, it just blows my mind.
So there are these ideas that you've got these spirochetes, these rickettsia, these different types of bacteria, and maybe one or more of them is causing it. Maybe it's all co-infection and there's another bacteria in there that we're not actually seeing. Maybe it's a
Mhm.
different spirochete. A lot of times when you have people who have had tick-borne illnesses, they have co-infections of various tick-borne illnesses because ticks tend to have a bunch of things.
Mhm.
They don't just have one.
Mhm.
So
Yeah.
that makes it more complicated to look at.
Mhm.
There's also, the idea, could this be some sort of other parasitic thing?
Mhm.
Could it be fungus?
Mhm.
And there's a lot of different ideas about that. There's one book out there that that says, and I shouldn't laugh, but talks about aspergillus,
Mm.
which is a type of
Aspergillus.
fungus.
Well, if you listen to our last episode, you'll know why we laugh about aspergillus. Okay.
Right, it's because of Sally House. It's not because
Because that would mean that we probably have Morgellons. Okay, we spent a lot of time in there.
right. So, but there is a whole book talking about
Are
how
you getting
maybe
itchy right now, or is that just
I
me?
know, right? So there's a whole book talking about how this could potentially be aspergillus. The reason I won't speak about that quite as much is because there's not as much literature on that. Really, the information that's out there on the potential for this to be Lyme or another spirochete, I think is stronger.
Better. Yeah.
But when you don't know what something is, you go out there and you look. You
Yeah.
try to figure it
Throw the
out.
spaghetti at the
And
wall.
and so could it be some other infectious agent? Absolutely.
Mhm.
I don't think I've seen a good argument for a virus.
Yeah.
I haven't seen that, but I've seen arguments for fungus. I've seen arguments for, single cell parasite
Mhm.
organisms, things like that. Um, is this a small worm?
Yeah. I mean,
So I've seen these arguments for different things, but I do think out of the infectious agents, the spirochete argument, I think,
mhm.
holds a lot.
Yeah.
Um, but then there's other arguments.
Well, before we go into that, there's one infectious thing that I want to bring up. It's not a spirochete, but it's another tick-borne infection, tularemia,
Sorry, I skipped
which
it.
is that's okay. It's sometimes called rabbit fever. It's more common in Europe than it is in the United States. But the thing that gets me about tularemia is it's another tick-borne infection, and one of the characteristics is this open sore at the bite, at the location of the tick bite, that is very similar to what people with Morgellons describe. And one thing we didn't even mention this, half the reason we even talk about this stuff being tick-borne and why that's important is most of the people we talk to, or a lot of the people we talk to, attribute Morgellons to a tick bite at some point. We heard people talk about different ways that they, feel like they contracted Lyme. We had some people who talk about it being, like contagious if you have it and someone else can catch it from
And we have
you.
people who said that they believe other people in their
In their
family have
household had
it.
it, yeah,
Or
or
pets.
pets.
We haven't mentioned that
Yeah,
um, veterinarians have diagnosed this in both
yeah.
cats and dogs. I
Yep.
don't know about other animals, but both cats and dogs. And
Well, and
so,
there's that one spirochete that is the like bovine encephalitis or whatever.
right,
That's in the Middle Vein article. That's in our show notes too. And that one presents not totally similar, but it's got these weird fibery things
right.
that are similar to Morgellons. But there's a lot of stuff going on with that infectious stuff, and we'll kind of come back to why I think why I'm interested in Lyme and tularemia in a second. But let's get through some other stuff first.
Um, so I do want to talk a little bit about the immune system and sort of trauma and stress. One thing that I believe holds true, certainly through our sample of 70, which, I just want to point out, I looked it up and the CDC sample was 115. So they had more people than us. But we actually talked to our folks.
We talked to our people. We didn't just
To a couple hours each.
records, yeah. So we did better. CDC, step it up. What are you doing? You're better than that. Come
Well,
on.
this is the CDC of a long time ago. Maybe they're better now. Let's not.
I mean, I don't know.
So, one thing that I will say kind of holds true across patients is they talk a lot about trauma in their lives.
Hmm.
And so I'm not saying, like, oh, you get hit over the head and you have Morgellons disease. Um, but when I talk about trauma, I think about the chronic stress response
Yeah.
that goes through the body when you have a lot of trauma in your life. And this could be physical trauma, emotional trauma, mental trauma, any of these different things. But a lot of patients will talk about how they noticed the symptoms after some sort of traumatic thing happening in their life. And that to me just signals immediately that maybe there was a depressed immune system at that time.
Hmm.
And if you talk to people about the cycles that they go through
Right.
with their Morgellons, things seem to be triggered again with some sort of trauma, which
Hmm.
immune system response. So it makes me start to think that even if it's not a cause per se, because I don't think this is something that is naturally in our immune system that like, hey, you have trauma and suddenly you're
It's
growing
not epigenetic.
filaments.
It's not epigenetic.
I don't think it's epigenetic. But I do think that there's an interaction with the immune system that we can't ignore.
Mhm.
That maybe the initial infection is one thing, but then the reasons for things popping up again later. And you see that a lot actually with viruses.
Yeah.
But again, there's no evidence that this is a virus, but hey, maybe it is, and we just don't know that yet. Um, but I do think the depressed immune system definitely has something to do with it. You also see this a lot you see this more in women than you see it in men,
Mhm.
though I have my own theories about that in terms of men not going to the doctor.
Yep. I was gonna say, yeah.
So,
Dudes are just like, I'm itchy. I don't know. Like, it's just itchy.
and I will say some of the women that I talked to said, well, my husband has this too,
Yeah.
but he won't
Yeah.
admit it. So I find that interesting. But whenever you see something that's more common in women than in men, and we also talk about women at certain stages of life, particularly, and I hate this term, middle-aged women, probably because I'm in that age range, uh, you have to think about hormones and changing hormones and how that might be interacting with whatever this is. And I think about all of those things, it does lend itself more towards that infectious idea
Hmm.
that then all of these other factors are showing, when it shows up, when it flares, things like that. So I do think, of course, I have this bias that I think stress causes pretty much every bad thing in our life.
I mean, you might not be wrong. So honestly, I'm here for it.
So I do think that's an important piece of it.
Yeah.
But then there are we'll call them fringe explanations.
Yeah. Yeah. So there's
Talk about those.
yeah, I would love to. I'd be happy to. So, I think, we kind of chuckle a little bit at the fringe explanations. And I have like two caveats for that. Number one, we're just as conspiracy minded as most anybody that we talk to. Maybe
Yeah,
quite as much, but
oh, I don't know because we
I mean,
took that test.
we did.
There's a scale that
Yeah.
measures how conspiracy
You
theory
scored
minded. I
really
scored
high.
really high, so
Well, I mean, we're recording a paranormal podcast, so I mean, we fall in that camp a little bit. But I think the other caveat I have for this is like, so given the background that we just gave about how people are received when they go to some healthcare practitioner with these
And in
symptoms.
some cases, it's three, four, five
Yeah,
healthcare
most of these
practitioners.
people, yeah, most of these people are going to multiples because they keep getting, essentially gaslit, like I said before. Um, and so all of that leads to people just thinking all kinds of, they're coming up with all kinds of weird theories to explain what's going on with themselves. It's, the year of our Lord 2025. We have the internet. Reddit is a thing. Facebook is a thing. People go online and start asking questions about stuff, and anybody and everybody can come in there and respond and give their own explanations. And so talking to some folks, they had some explanations that we would call fringe. And so some of these, like, we had people talk about chemtrails, like you mentioned that one, the website that's not no longer, as is not the person who ran it before. Um and so people talk about, I interviewed people who talked about, I see it, I think it's in the chemtrails. And I had someone tell me point blank that it's nanobots that are in the chemtrails that are being dropped down on us and infecting all of us. And we're just not being told about it. People talk about different energetics, and that I don't have a great explanation for, but, different energies impacting the body and making the body do different things.
Your
Um,
body has a lot of electricity
it
running through
does.
it.
It
And
does.
I do think that that is the cause of a lot of things is imbalances in electricity in our bodies.
Yeah.
That's your nervous system.
Right. Right.
So, you know,
Yeah.
just throw it out there.
Yeah. We have, this is a common theory, I think, that people talk about, is the idea that it's extraterrestrial, that either it's an actual extraterrestrial infectious agent, or, that extraterrestrials came here and gave it to us, kind of thing. Um, so people talk about that, and I think you had one person that you interviewed that was like, I'm not going to rule it out. And it was like a perfectly reasonable, perfectly, like, was that one of the nurses you
Yeah, it was
interviewed?
one
Yeah.
of saying like, hey, I'm not going to rule that out because how can I? We
Right.
don't have any real reason for this to exist.
Yeah.
We don't know anything about it. So how can you rule out anything? I
Yeah.
think was her point.
Yeah.
And I kind of agree
I
with her
agree. Yeah.
that you can't rule out anything because we truly have no idea.
Yeah.
And we do know that there are microbes on asteroids that have
That
come
can
down. So,
survive. Yeah.
I mean, I'm not saying that that's my favorite theory.
Yeah. Yeah.
But I
But
see where your mind
mhm.
can go there.
Mhm.
And I definitely see how your mind can go to the more fringy explanations
Mhm.
when you're being told by every doctor you go to that no, this is not real.
Right. Yeah. There's also a lot of folks that talk about, the idea that it's in vaccines, and we have talked a little bit about, our curiosities about the change in people's conversations about the cause of Lyme pre and post, or cause of
Because
Lyme, sorry, cause of Morgellons pre and post COVID, because a lot of that conversation comes out of the COVID vaccine hesitancy and
say it
stuff.
comes out after COVID.
Yeah,
And I mean, some people think Morgellons, showed up during COVID or
during
shortly
COVID.
after. It's been here longer.
Yeah,
That we know. Um, but I do see where that comes
yeah.
from. Uh,
Yeah, and then the last one that I want to point out, is this idea that it may be some sort of bioweapon. And this, like,
at first, I was like,
at
no.
first, this sounds absurd, right? This sounds like, come on, really? I mean, first of all, like, how ineffective of a bioweapon is it? I mean, I don't know anyone who had Morgellons until I did this project and then interviewed them. It's like, if it was a bioweapon, like, if it was a good one, everybody'd have it, right?
No one said it was a good one.
Well, that's how I know. I'm just saying. I mean, it's weak if that's what it is. Don't at me, Department of Defense. But people talk about it being a bioweapon, and one of the ways that they talk about this is through conversations about Lyme being a bioweapon. And so there's a book that came out a handful of years ago called Bitten by Chris Newby. You should check it
Another
out.
great book.
It's a really, really good book. Links in the show notes. Read it. It's very good. About the question of whether or not Lyme disease was actually developed as a bioweapon for use during the Cold War. And it talks about all of the bioweapon programming that the federal government, the Department of Defense, was doing during the Cold War with
And it
really,
is interviews with
scientists, and Bergdorfer, Willy Bergdorfer, the guy who identified Lyme, She talks to him, she talks to his family members, she goes through all of his archives, all of his lab notes, everything, and sort of digs into his history and the story of Lyme. Because if you're not familiar with the story of Lyme, basically was in 1970s,
Early 70s.
early
Early
70s.
70s.
People in Lyme, Connecticut. This is where
Connecticut.
Lyme. We're back to Connecticut. We're coming
I
full
was
circle
not
here, folks.
living
In
in
there in the
Connecticut
1970s.
70s.
But we're back full circle back to Connecticut, right? Lyme, Connecticut, people start having what they call Lyme arthritis. And basically, they're presenting as what we would say is Lyme disease now, but they didn't know what it was then.
1975.
1975. Okay, thank you. And so Willy Bergdorfer, he's working at this lab at the Rocky Mountain Lab. I forget what the whole name is, but he's working on rickettsias. He's doing research on spirochetes and things like that. And he identifies Lyme from some ticks that were sent out to him from Connecticut. Now, the interesting thing about that is that the USDA had a lab, and I think they still actually do have a lab there, although I could be wrong in that. Had a lab right across Long Island Sound from Lyme, Connecticut on Plum Island. Now, there's another book you can read about Plum Island. It's called Lab 257. I couldn't get through that one.
I haven't tried yet.
Your mileage may vary on that one. It is very dense. There is more information in there than you could ever want. But the argument, or what we do know about what was going on Plum Island is that they were testing different infectious agents, specifically on how they would impact the livestock and agriculture of the United States and other countries that we might drop a bioweapon on. And um, so the going theory is that Lyme originated there and escaped from Plum Island. And there's reports of workers who worked at Plum Island having to kill wildlife that were on the island. There were reports of wildlife because that section of Long Island Sound is not actually that big. And so there are reports of deer swimming that section of Long Island Sound. So the reason it stands to reason that that a deer could have swam across with an infected tick, and then next thing you know, we've got Lyme disease everywhere. And so while that may seem like a totally far-fetched tinfoil hat theory, it actually I can't recommend Bitten enough because I mean, I read it in like a day. And I'm not one of those people that reads books in a day. Chris is. But I cannot recommend it enough. Chris Newby does a great job of researching the history of not Plum Island really, but about the Lyme story. And she does it as someone who got Lyme. Her and her husband got Lyme, and that's what kind of motivated her to write the book.
And just to talk for a second about that timing, Lyme disease, okay, it was named in 1975, and we're talking about actually the years prior to that.
Yes.
So when we talked about like Morgellons symptoms showing up in the 1950s,
40s and
maybe
50s,
the 40s,
that's at the height of this
the research
of this project that they were doing with diseases like tularemia that I mentioned. Interestingly enough, I will give you this little tidbit out of the book because it really did blow my mind. So there is an army base called Fort Detrick, and that's where most of the Cold War era bioweapon research happened. And during the Cold War, and particularly during like Vietnam era and parts of World War II, so we're talking tail end of World War II here. If you wanted to be a conscientious objector, meaning you get drafted and you're like, well, I love Jesus so much I don't want to shoot a Nazi, then you could be recruited into doing this bioweapons testing, where basically they were testing bioweapons on you to find out how they impacted people.
So you can elect to harm yourself instead of somebody
else. Which, I mean, you know what? It's an ethical question, and that's, between you and your God. So, live your life. But that's just a totally wild thing to me. And she has all kinds of documentation in the book. And it's, for a while when we were doing this research on Morgellons, it would come up with people and I kind of took it with a grain of salt. I was like, yeah, I mean, sure, why not? But it was kind of just like with the extraterrestrial explanation. It was like, well, I mean, I'm not going to rule it out because we don't really know, but I'm not going to give it more credence than I am, say, something like Lyme by itself, just like a disease that happens. But after reading that book, I'm just like, okay, now I'm a little unsure whether or not.
Because we know that the person who was researching Lyme disease was in fact
He was
working
working
on
on the bioweapon
bioweapons.
program. He worked at Fort Detrick for a minute, or worked with researchers at Fort Detrick. If I remember right, he ended up at Plum Island for a hot second doing some stuff with them or corresponding with folks at Plum Island. So there's connections there. It's not totally
Right.
disconnected,
It's
right?
interesting, and I'm
Um,
not saying it's a bioweapon. But it's interesting, and the history of what was happening at that time period,
is
even if it has nothing to do with Morgellons, really interesting
is
history.
wild. It's
It's
absolutely
really
wild.
interesting.
Yeah.
Um, just teaches you a lot about, the kinds of research that happen every day that
Hmm.
you don't even realize is happening, and they happen for very legitimate reasons. I don't want to, go into that.
Yeah.
And can I just say, there's been a police officer who's driven by my house like 3 times since we've been recording
That's
this, and
spooky, man.
it's just kind of
See?
freaking me out.
Over here talking about bioweapons. Big brother is listening.
It's a
Oh,
little weird to me, but
that is super weird. I'm glad you didn't tell me that until just now.
okay.
Because I'd have been like, oh yeah, no, not a bioweapon, not at all. Couldn't be.
But the interesting piece about this is there were several interview participants who told me to be careful
Yeah.
researching this
Yeah, we
disease.
talked. There was a researcher that I interviewed.
And that's just weird to me. No one's ever told me that about anything I
Yeah, and
research.
it was a Lyme researcher, and she had published some stuff, and we got connected through another person that I interviewed, and I was like, hey, yeah, I kind of want to talk to you. You seem like you do some stuff that's adjacent, even though it's not Morgellons. And she point blank told me the story of like how she had had trouble doing some parts of her research, publishing stuff, and it was like totally innocuous stuff about patient experience. It wasn't
Yeah,
even like I'm saying Lyme is real or Lyme is a bioweapon or it's Morgellons or anything like that. It was just like, this is how patients are treated. And I was like, that's nuts because that should not be a problem to get that published. That
right.
shouldn't be an issue.
So those kinds of things happening make you just sort of say, "Oh my, what is this?"
Hmm.
Um, and again, I'm not saying this is a bioweapon. I'm just saying that the possibility exists.
It has
Um,
to be entertained. You have to
yeah,
entertain it, right? It's
yeah,
because no one's taking it seriously,
exactly,
because we're sitting
exactly,
on one CDC study that was poorly designed
right.
and saying that's good to go. Like that's
To replicability. Anyway,
I don't know.
all the scientific method
I
thing.
don't know,
Anyway,
man.
um,
So those are what possible explanations for Morgellons are. So
but what's interesting to me is that each individual, when you talk to people,
yeah.
when you talk to an individual and you say, how do you think you got this condition, this disease? And they look at you and they say, well, I don't know how these other people got it, but my
My
Morgellons is
Morgellons. Yeah.
from X.
Hmm.
And I mean, it can be my Morgellons is fungal.
Hmm.
My Morgellons is from a spirochete.
Hmm.
My Morgellons is from trauma in my life. And people say this very with conviction.
Yes.
And they say, and this other person's might have been caused by a spirochete and not mine. And so it's an interesting way to describe it because if something's a spirochete infection, that's what it
That's what it
is.
is. Yep.
But that's not how people think about this. And so there's these very, very individual explanations. My Morgellons is caused this way, and yours might be caused a different way, and that's cool too.
Hmm. Yeah,
Acceptance.
there is this like big time acceptance. Like while people in the community are very they have a lot of conviction behind their explanation of what they think Morgellons or their Morgellons disease is or was caused by. There is like because of this sort of general lack of acceptance by outsiders that like people within that community are like that's fine, you can think that it's nanobots but I'm convinced mine's Lyme, and people are still like we're in this together as Morgellons patients. And that's I think again that speaks to like just how marginalized these patients become, that like they're not worried about fighting internally about what it is because they all have the same goal of being taken seriously.
But wouldn't it be cool if more people were that accepting? Just
Oh yeah, it
yeah.
totally would. It totally would. But I don't think I want filaments coming out of my body to get us there.
No,
So
I do not. So that's what we think Morgellons is or don't know what it is.
yeah.
But regardless, people are treating themselves or are being treated by some Lyme literate doctors, some naturopaths. There's actually a decent number of naturopaths who will treat this. One patient told me about a clinic they went to in Mexico
Yeah.
that was treating some of this stuff. So there are people out there who do treat this from a medical perspective. And a lot of that is through courses of antibiotics, in some cases antifungals. I haven't heard antivirals, but antiparasitics,
Yeah,
absolutely.
people talk about that.
Um, but what's more interesting to me are actually the people who are treating it themselves.
Yeah,
And they're
which
basing
is
this on
incredibly
things,
common.
yeah, and they're basing it on things that they're reading online in the different chat groups. And there are a lot of them.
Hmm.
Um, but it's frightening in
Hmm.
a lot of ways because people are doing some things to themselves that could be potentially very, very harmful.
Yeah, I mean, there's
Um,
people that talk about like using like DDT and stuff on their skin.
yeah, we
You
learned a
know,
long time ago DDT is not awesome.
it's not good. You know, and people are just desperate to do anything for any kind of relief. I mean, we heard a lot of people talk about using ivermectin,
Yeah,
which we had talked about this, and that was like also a thing before COVID too, a little bit.
a little
So
bit, but I wonder what,
if that blew
if
up
that blew up after
during
COVID.
COVID
Yeah.
and after COVID, yeah. Yeah, and I mean, I had one person I talked to, um, you know, was convinced that the antipsychotics she was on were working, but not because she was psychotic, but because of a compound that was in the
Right.
antipsychotics that were treating the parasitic infection that she thought it was. And so, you know, it's because the medical establishment is not taking it seriously, it's leading to all these theories that like we can't say one or the other is a better explanation or not, really. I mean, some sound better than others, but we really don't know.
Yeah.
And at the same time, then because of that, we've got people who are out here, you know, putting things in their body or on their bodies that are not good for them, you know, because they're that desperate.
They're looking for relief and they're
Yeah,
willing to find that relief in any way they
yeah,
possibly can.
yeah.
And and it's frightening and it's sad
Mm-hmm.
that people are not being treated by the medical professionals
Mm-hmm.
and therefore they're looking for anything they can find. And some of it's innocuous stuff like, hey, take some extra vitamin D.
Yeah, yeah. A lot of people take like
You know
herbal
what?
supplements and stuff like
Vitamin D is
that.
great. Go out in the sun, get some.
Yeah, yeah. We're
Um,
all vitamin D deficient, so it probably won't hurt
so
you.
go right ahead. You know, taking baths and Epsom salts, I think that's wonderful. Certain things like that make, there's no
Yeah,
harm in doing those things. But I mean, people are talking about, drinking borax,
yeah,
and there is harm.
yeah.
There is potential harm in some of these things. Um, so, it's frightening to me that people are being really, in my opinion, forced by the lack of concern of the medical community into just trying whatever they can to get some relief.
Hmm.
And it's about getting these filaments out of themselves because people talk about how if you can get these things out, you get some relief from the itch, you might get some relief from the pain,
Hmm.
and that's huge. I mean, if
Hmm.
you've ever had chronic pain, you
Yeah,
know how horrible that can be and it affects every aspect of your life. That plus chronic itch, forget it. I mean,
yeah.
how do you function?
You don't.
And so people are really looking for anything that's going to help them. And so I wouldn't promote any of those things. I say, find out what works for yourself and go for
Right.
it. But I'm not going to sit here and say, well, so and so said, because everybody has a different sort of protocol that they're following, and you can't tell someone what to do.
Hmm. And we're not that kind of doctor
Oh
anyway.
God,
So.
no. Nope. I can say doctor, but not that kind.
Not that kind. Not that kind. Travis was diagnosed with delusions of parasitosis by an emergency room physician. He continued to suffer and ultimately went to Dr. Ginger Savely, who was the only one to believe him and the only one who could offer him any help, though it was not enough. He continued to suffer. He lost his job, became embarrassed to be seen in public, and spent a year locked in his room to hide from the world. His case was incredibly complex. Here is another excerpt from his story as told by Dr. Savely. We seemed caught between a rock and a hard place. We'd take one step forward and two steps back. Meanwhile, other Morgellons disease patients of mine were having symptom flares but getting past them and going on to notice a marked improvement with antibiotics. But without improvement, there was no hope. Eventually, life with pain and fear and without dignity or hope seemed pointless and unbearable. One Sunday afternoon, the horror of it all became too much to bear. In search of sleep and pain relief, he took what proved to be an excess of sedating medications and slipped away from his earthly prison. His mother found him a few hours later, and through the shock and sorrow, she couldn't help but notice that it was the first time in several years she had seen a peaceful look on his face. A strange mix of feelings overcame her, the gut-wrenching agony of losing her only precious son, mixed with a sense of relief that his suffering was finally over.
So that was a depressing end to Travis's story. And I have to say that unfortunately, that is the end that I don't want to say the majority of it, but a decent number, too many Morgellons patients face.
Yeah, and a lot of the people I talked to talked about problems with suicide
I'd
ideation
say
all the time.
almost every person I talked to had thoughts of suicide.
Yep.
And a disease that is causing that, any disease that is causing people to have those kinds of thoughts to any level, and in this case, it's almost across the board. I mean, this is real. Anyone who says that Morgellons isn't real, look at the consequences that this is having for people. And I don't even think that it's just the disease, because when you talk to people, they don't just talk about the disease itself. They talk about what the medical community is doing to them. And that is what's causing these problems. And not just the medical community, but their friends, their family who don't believe them. And that's what's causing people to feel alone, to feel depressed, and turning to something like suicide as a way to not only end their physical suffering, but to end the isolation that they've experienced. And I know we've mentioned COVID quite a bit over the course of this episode, but if you look at suicide rates during COVID, they went way up. And it has to do with that isolation that people feel. And I feel like I can say this now because we've all experienced COVID. Isolation is terrible. And when you feel like you can't talk to anybody, and in this case, you're talking about folks who try, who try to talk to other people, try to get others to pay attention to them. And they turn to, whatever they can to get some relief, and they wind up losing people in their lives. And so, the mental health issues surrounding Morgellons are real, absolutely. But so is the physical reality of the disease. To tell people you're not experiencing this isn't real without even examining them is not okay. We wouldn't do that with other types of illnesses. And that's it's just not okay. So, whatever causes it, I am fully convinced that Morgellons is a real disease, though I actually think it should be called a syndrome. Syndromes are groups of symptoms that, when a person has a syndrome, they don't have every single symptom within that syndrome. And I think that's the case with Morgellons. There's a lot of different pieces to this, and you don't necessarily have all of them. And that makes it harder to diagnose. So I personally don't like the fact that we call it Morgellons disease. I would rather call it Morgellons syndrome. Though, that's semantics to a degree, but I do think it's a more accurate statement that way. But I feel very, very convinced that it's real. And I mean, jump in.
Yeah, no, I mean, there's no question in my mind at this point. I mean, I can't, I don't, I mean, I'm not a medical professional, so we'll start there, right? But in talking to folks who have it, and even beyond talking to folks who have it, talking to family members, they were almost more convincing in a way because, they have nothing really personal necessarily to gain from talking about the diagnosis, right? And they've had to watch someone in their lives go through that and not be taken seriously. And I just can't, you can make the argument that like Morgellons patients have mental health problems, right? And I would argue that it's probably because of a consequence of the disease, right? Or the syndrome. But you can't tell me that you're going to have to tell me that it's like some sort of contagious delusion that, you've got family members and husbands and wives and whatever who are like, yeah, no, my
And the pet.
spouse and the pets, right?
The
My
pets have
spouse.
delusions of parasitosis.
Hey, man, I don't know.
They found it in infants too.
Look, I ain't no Dr. Doolittle, so I can't talk to dogs. I don't know. But my point is, why, I just have a hard time buying that, that there are that it isn't real in that sense, right? And talking to physicians too, who like treated it, like, well, I mean, they're the experts, that's who I would go to if I had this and, wanted to deal with it, or was forced to deal with it. And I mean, I can't question that, and I think it's sad and unfortunate that, you know, I think about, I'm not that far from finishing my dissertation. So I think about if I would have relied on one singular citation that much to like, and like nothing I was relying on was really impacting anyone's life, really. But like, like relying on one single data
You mean the
point.
CDC?
Yeah, yeah. I mean, in the CDC
Yeah.
study, right? Like if I were to rely on something like that, like we talk, like you were saying before, we talk about being able to replicate things. And I mean, I've talked to patients who, you talk about Ginger Savely, how she was like, I have all these patients, like they all have it, please, do something with it. And I talked to like patients that I interviewed that were like, yeah, I've sent stuff in to people, and I tried to send stuff to the CDC. I talked to this one Canadian guy who was super cool and like tried to work with people with like the Canadian version of the CDC. And they were totally, just like, no, we're going to go buy that one single study that is not well designed and, doesn't really
Because it's for
do justice to people. Yeah. And I just think like it's crazy to me that like we're just willing to write off people that easily.
and a lot of
And a
people.
lot of people, yeah, it's like not, yeah, I mean, it got to the point where, we went through our initial set of people we wanted to interview, through our connections at the Holman Foundation. And then we were like, okay, we want to expand a little bit. And then we started looking at social media and like we were overwhelmed with people wanting to talk with us. And we even like pulled back from what we initially thought we were going to do
Yeah.
online, because we were like, okay, I think we're good. I think we've got what we need. But we could have sat and done these interviews for probably another year or two and
Because
still
we
got
didn't
people.
just want to interview people, we actually do want to write a book.
Yeah, well, yeah, 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 yeah,
And targeting to a degree medical professionals,
yeah,
like, hey, maybe you should listen to these
yeah,
folks. They're your patients.
yeah. I mean, that's just, yeah, and I think that's what, and I mean, maybe that's like part of what's bugs me the most is as someone who's built my career on just listening to people talk about their lives and stuff. Like I'm just like, okay, I mean, I think that's valuable, but you're a physician. Like you should care about what I'm explaining to you is happening to me in my body. Like,
Physicians are supposed to listen to patients too.
right, like that's
Called the medical history.
yeah, like that's the whole thing, right? Exactly, right? Like where's my case history at, right? Like that's the you're supposed to do that. That's part of your job.
Right.
And like I think, there's a certain degree, I don't know. I think there's a lot of politics involved. Um, but I think there's a certain degree of arrogance there that's like we can't ignore, right? Like you can be wrong and it's okay and you should admit when you're wrong. Like that should be something we should be better at doing in general. Um, and so I think, why aren't you, I mean, again, I say this as someone hosting a paranormal podcast. Why aren't you curious about the world, right? Like, why are you assuming that like everything is as you're being told, right? I mean, it might be a little easier to live through the world if you did that, but like at the same time, that's weird. Someone comes in and they say they've got filaments coming out of their skin, and like you're not even going to bother to be like, okay, let me see that. I'm curious.
Yeah, I
Like,
certainly would be curious.
yeah, like how do you not do that? I mean, even if you ultimately land on the delusions of
The
parasitosis
veterinarians
diagnosis.
look. The veterinarians,
Yeah,
when people talk about bringing their pets to the veterinarian, they look.
yeah.
Why are they more willing to believe than the medical doctors?
I don't know. I don't know. That's a
Um,
good question.
but it makes
That's,
me,
I see lots of weird stuff all the time.
yeah,
Like
it's true.
honestly.
But it brings me back to something that I've said before, not in this podcast, but that I watch what happens to the Morgellons
Mm,
patients, and I start to think about the beginning of the HIV pandemic and
mhm,
kind of what was done to patients then, and how they were stigmatized and pushed aside and not listened to. And it feels similar, and that really terrifies me because we look at what happened with
mhm,
that pandemic. And I am one of those people who fully believes that there was a point early on where we really could have stopped the spread of it from becoming what it is
mhm,
today. And we
mhm.
didn't. And when I say we, I mean everybody. I'm not pointing fingers at any one individual. Um, there was a point where we could have done something, and we didn't. And I'm worried that the same kind of blowing up in terms of the numbers of cases could happen
Hmm.
here. And
Hmm.
and I don't want to sound like a true conspiracy theorist here without, but I mean it is reminiscent and it's scary because of that.
Well, and I think that just speaks to taking people's experiences seriously,
Yeah.
right?
Yeah.
And that's true of all of the stuff we're going to talk about on this podcast,
Yes.
whether it's medical mystery or somebody saying they talk to fairies in their backyard. Like there's something to taking people seriously,
Right. Listening to people, it means
Yeah,
something.
yeah. And like it's okay to, take people seriously, and sometimes it's important to take people seriously.
So just to think about that,
Hmm.
we have future research planned on this, and we've been talking about this research that we've been doing, really looking at just the lived experience.
Hmm.
And we mentioned been working with the Charles Holman Morgellons Disease Foundation, specifically a woman there by the name of Cindy Casey, who
Hmm.
is fantastic,
Hmm.
wonderful, wonderful woman and nurse, one of those nurses,
Hmm.
who really has brought a lot of attention to this disease. And I wanted to just thank her
Yeah,
publicly
yeah.
for all the help she has given. Um, you may have seen the movie, or I would recommend you see the movie Skin Deep.
It is in the show notes.
It's in the show notes. It is a phenomenal movie.
And it's on YouTube, so it doesn't matter what streaming service you're
Right,
using. If
that's
you
right. It's
have
on
internet,
YouTube.
you're good to go.
And so this is a documentary, and Cindy's in it, and the foundation is in it, talking about what this disease is and what it does to people and all of that. And it's put out by a guy by the name of Pi Ware, who I had the pleasure of interviewing as a part of this research project. And what a phenomenal job he did. I just have to say,
Hmm.
really, really phenomenal job. And unfortunately, the premiere of it kind of got messed up because it happened in the middle of
Of
the
COVID,
beginning of
yeah, yeah.
COVID. Um, and, unfortunately, I don't think the movie got the credit that it deserved because of the timing of when it came out. So I really, really encourage you to go to YouTube, watch this. It is amazing. It really gives you a sense of what it's like for people to go through this. So I just wanted to kind of throw that out there. We are planning some future research in this area. Once this study is done, one of the things I'd really like to do is restart a way for people to sort of register their symptoms, like go
Mm,
online and say like, hey, here's my experience with
yeah,
Morgellons. Let's try to get an epidemiologic study done.
yeah.
That's one of my one of my backgrounds is in
Hmm.
epidemiology, and I think getting a nice examination of who has Morgellons, where it's found, what the symptoms are, getting that epidemiologic study. We're all a little more familiar with that again, thanks to COVID. But let's get that study done, because then maybe we can see if it's infectious. Once you
Hmm.
start understanding those things, you can start understanding where something comes from. So that's another step that we'd really like to take, um, to try to move the research forward.
Hmm.
So this is an area that we will be covering again at various points, because it's an active area of research for us.
Hmm. Hmm.
So you want to tell everybody what's coming up next?
Yeah, thanks for tuning in on this episode of Beyond the Human. We're excited to come back to our more traditionally paranormal programming on the next episode, although you're going to get medical mysteries in here because they're fun and weird.
Because I'm here.
And because Chris is here, but they're fun and weird too. Like I like it because it gets me out of my wheelhouse a little bit. Um, but no, so next episode we're going to be talking about the culture of ghost hunting in the United States, and talking a little bit about, what's the worldview of ghost hunters? How do ghost hunters approach studying what they study? Opinions of ghost hunters from an academic perspective, and kind of mesh that in with some of our experiences investigating the paranormal. So hopefully you'll tune in. That'll be just in time for the Halloween season. So um, it should be good for
Haunted season.
all your, yeah, haunted season. If you're feeling spooky, come listen to Beyond the Human. Thanks for joining us on Beyond the Human, where the strange, the supernatural, and the deeply human collide. If today's journey into the unknown sparked your curiosity, we'd love for you to subscribe, leave a review, and share the show with fellow seekers of the extraordinary.
Have a story, question, or theory of your own? Reach out. We want to hear how the paranormal shapes your world, too. You can find us online at Patreon, Facebook, and Instagram.
Until next time, stay curious, stay critical, and keep thinking beyond the human.